what happens in abscess? So this tissue, lung tissue, is completely dissoluted. So whenever you look at the gross of the lung abscess, you should remember that there is complete dissolution of the lung tissue. So obviously there is some cavity formation that will occur there, and in that cavity there will be a lot of pus, suppuration, inflammatory cells which will be there. So normally when the abscess is acute, it will be lined by the acute inflammatory cells. But slowly when it becomes chronic, then it will be lined by macrophages and fibroblasts. Okay, so obviously when you look at the acute abscess grossly, it will have a very shaggy borders. It will have a very shaggy borders because acute inflammatory cells, that is neutrophils, will be infiltrating here and there. So it will have very shaggy borders. But once the fibroblasts are well formed around that cavity, it will form a well outlined abscess. It will form a well outlined abscess. So acute abscess versus chronic abscess can be made out by looking at the appearance, shaggy outlines and well-defined outlines. So that should be very clear. Now that's the gross. When we look at the microscopy, same thing replicates. If you're looking at necrosis of the lung tissue surrounded by acute inflammatory cells, that is neutrophils, it is acute abscess. When it becomes chronic, what will you see? You will see lot of fibroblast and macrophages in it. So then it will be a chronic abscess. So that is the microscopy of acute and chronic abscess. Also, everybody should remember at this point of time that because it is full of necrotic tissue, okay, and inflammatory cells, so the typical symptoms that patient will have is, because there is a lot of inflammatory cells, patient will have fever, okay, and because there is a lot of inflammation going on, there will be weight loss, so patient will have fever, weight loss, and he'll be coughing out copious amount of sputum.